level of threats that are increasing on the critical data and on their networks are growing. So we have the speaker of the session, Ms. Jabin Pathan. She is Deputy CIO Shalby Ltd as a panelist. And then we have Shri Girish Koppar ji. He is ITH GMIT Wockhardt Hospitals. Welcome, sir. So we can't hear you. Ma'am, we can't see you.
You need to enable that. Okay.
We can see, sir. Ma'am, can we see you, please?
Actually, okay, fine. Okay. Can you see me now?
No, ma'am. We got a glimpse of it, but now.
Okay.
Ma'am, I have sent you the webcam request. If you see, you can. Yeah.
No, okay. Sir, hi. Hi, Praggya.
Hello, ma'am. Hello, sir.
Yeah, hi, Girish.
So, ma'am, healthcare is facing the major challenge of digitization is happening and is very recent in the healthcare sector. So, how do you think that it is important to have a security and cybersecurity by design in the healthcare sector? And how do you see the awareness and how do you see the critical role of CIOs and CISOs in securing the digitization in healthcare? I think there's some glitches. So, ma'am, can we start with you? How do you see the role, changing role of CISOs in increasing digitization and work from home culture with COVID-19, that pandemic that we have been facing?
Yeah, so see, with this change in the scenario post COVID-19, many of the things have come up on the healthcare IT, especially in the healthcare sector. And if you see, healthcare is kind of a low scale on the digitization. So now people, hospitals and all have started moving into the digital transformation. So basically, it is becoming IT has become an enabler now rather than a back-end process. So what has happened is initially the hospitals were using the IT as something which can generate the revenues or it kind of an HIS system and all. Now with this COVID-19 scenario, what has happened is it has completely transformed the healthcare industry. And people have started going online. So most of the work, if you see, there is a work from home scenario which is coming up. There are a lot of challenges which is happening in the entire gamut of this healthcare industry. Like people are working from home, then the footfalls in the hospital has reduced. The collaboration between the team is happening online. Now the meetings, the discussions, the critical key decisions are happening online. Okay, and if you look from the clinician's point of view, what has happened is people have started using, doctors especially have started using system as their entry point and started recording the medical records. And with this COVID-19, government is also emphasizing on how hospitals can become an enabler to trace this entire healthcare gamut. Kind of so especially when you talk about the COVID-19 COVID patients, that is entirely happening by using a tracing method on the mobile tracing. And healthcare is slowly moving from a desktop based system to the mobility based system. And digital marketing is the another area where people are focusing more, because at this point in time people are more online rather than they are coming to the hospital. And the worst thing is, like, the patients, they say that, okay, we want to avoid coming to the hospital. Now few scenarios like work from home, doctors going online, usage of the telehealth solutions, usage of patient monitoring device, when you talk about your home care services, those and all has increased. Now all this increase in the technology has somewhere make this entire healthcare IT system vulnerable. So so now the going forward, the organization has to focus more on investment on the IT security, investment on how automation can be brought in, how reach to the patient or reach to the customer can be emphasized using digital marketing and digital promotions. Okay, how you can make them aware of the whole situation. If you can see, there's a Setu app which actually tells you if you have a COVID patient nearby. And with the use of the mobile, see, people now, most of the thing, if you see, mobile is the enabler for everything, and every information is available on the click of a button. So this is making healthcare a little bit more vulnerable, and this is the soft target for all the ransomware. So when you say, if you might be hearing a lot of things which is happening, like this particular hospital has been attacked and the patient data is leaked, and this particular recently there was one maze virus which has come where the entire data has been pulled from one server to another server, and then the locking happened. So healthcare being a soft target, and most of the patient's critical data, patient data, is lying on the healthcare, with the healthcare. And so if you look into where the healthcare industry is moving, it is moving from a back-end IT process toward a digital transformation where IT becomes an enabler, and how security is the key focus for that. The main focus is the security. I think Girish has joined. Hi, Girish.
You can hear me now?
You can hear. Okay, so I was just telling Praggya about.
Yeah, I was listening. Yeah.
Okay. So maybe we can just you can add up your points into this scenario where I was telling how the entire shift is happening from a non-technology driven hospitals to a technology driven hospital, and how the entire security has been considered as the key point over here, and how the management has to focus more on governance of the entire like how the governance has to happen, how the process has to be defined. So those things I was just talking to Praggya.
Praggya, is it possible to share a presentation, because we had done a presentation?
Yeah.
Where is the option?
So would you like to share your presentation?
Yeah, we have jointly done a presentation.
I'm making your presentation, so then you can do it.
Yeah, please.
So now you can show the presentation, sir. So I'm switching off my camera so that attendees can view it more comfortably.
Now, is it visible?
Yes, it is.
Yeah. Yes.
Okay. So I'll just highlight on a few points which my co-panelist had this thing. Now, the current scenario, as my co-panelist, she had mentioned that now everybody is looking to the IT for a solution, because now they feel like sitting at home, only thing which can connect the people who are sitting at home during the lockdown and the office is IT through internet. So there is a lot of dependability on the IT. The people are looking very eagerly, like what solution, how they can work from home, and these are throwing up new challenges, as ma'am was saying. So these open a big Pandora's box in terms of IT security, because this was never done before. Though as a IT professional working in a 24 by scenario, we are exposed to a 24 by scenario, but not the other people, not the other departments. Suddenly finance wants an access, HR wants an access. There are limited access, so we don't have the infrastructure. So all these challenges are there. One is from the technology point of view, and secondly, rightly, there is a very low footfall. So how to again the business is affected. So again, the management is looking towards IT, like, okay, can you provide a teleconsultation? Can you provide a telemedicine? So all these solutions now, IT suddenly from a process or from the service department, it has now become a game changer, and now it is a key to the business continuity or increasing the business. So all these current scenarios are being come up in the current COVID scenario. So now, how do we deal with this scenario? So we have made a few points in this. So whenever we are giving access to others, we have to ensure protocols are taken care of. I'm sure Madam will be able to throw more light on this cyber security. Then ensure that the right privileges are given to the users. Then also from the hardware point of view, though we are sitting at home, we have to ensure that there's a lot of redundancy in terms of PCs and printers so that everything can be managed. Even the hardware can be managed remotely. Like if we have a network printer or a PC which can be shared, that is possible. Then as a Wockhardt, we already have started teleconsultation. This was something new. So what has changed is now suddenly people have understood the power of technology and they are adopting technology very gracefully, and they are they are not adopting. There was a lot of resistance to adoption of technology, which has changed. So now, post COVID, also the management is looking forward to IT, how it can automate all this. Now we have won the battle during the lockdown. Now, what next? Can we have all the consultations to be over a phone or a teleconsultation? Can we start telemedicine? Can we have the workforce, some portion of it working from home? So all these new things have come up, and so suddenly IT is now the center of this thing for driving business and even futuristic how to plan. So this was a few slides which I've prepared. Over to you, madam. You can just
Yeah. No,
take over.
so basically, see, I'll just give a small example of Shalby. So Shalby was not uh, so keen, especially the doctors were not so keen on going online as well as the use of bots, basically. So now, with this situation changed, what has happened is, and healthcare is the sector where people usually don't prefer to work from home. So it's like when you come to the office is where you people can see and people can interact and they do the decision. But this complete scenario has changed now. People have started working from home. People have started accessing applications from home. There are many mobile applications where the users are actually with a click of a button able to connect with the doctor. Doctors are ready to access things which previously they used to come to the hospital and do that. So now sitting at
Yeah.
home, they are able to do that. And to do entire all of this thing, see, it is very important that management buy-in should be there for making sure that it is completely secure. So see, it's a demand comes like this. Okay, I want to implement something. Okay, because business is also impacted. So what is the quickest solution you can give? And IT itself is risk assessment has to be done before we plan for anything. There's a governance has to be maintained and processes and protocols has to be defined. And everybody is like coming up with, okay, till yesterday, there was one customer who was actually not in the video consultation before.
Mhm.
The moment this change happened, what has happened is next day he's calling me and telling me, okay, I have a solution for you. But when the question comes like this, okay, I have a solution. Have you taken care of all your security? How are you going to manage the patient data? Have you now with the, if you see the entire government policies are getting changed. Previously, the government was not releasing so much of protocols, policies and everything. Now those everything is changing. Every day you can see there's one more norms coming into the coming to us from the IMA saying, okay, this is how you need to maintain the prescription. This is the service which you can provide online. This is the services which you have to provide offline. The same thing with the, if you look from the management point of view, they are like, okay, if I work from home, how effective it will be? Is it secure? What is going to happen to my data? Because it's going, everything is going on a public network. And the thing is like, okay, are we ready from the back end? Is the IT system ready to take up this much of load? So we recently faced a lot of bandwidth issue. We have faced many other issues like, okay, this person is not able to access, that person is not able to access. And when everybody starts coming from different places, it is where my entire bandwidth gets choked and it becomes vulnerable. Okay. And
Yeah,
we give a
exactly.
solution, then are we looking into the security part of that? I think in the previous session, one of the person has told cyber security in the for the police case, the security is very important. The same way in the healthcare, patient data, how are you going to protect that? And immediately, if you ask me, ramp up your security, that's also again how to do that, because entire thing is nothing is functioning. People are still working from home. They take the remote access and then they try to do something. But this all makes system vulnerable, and we need to see how effectively we can use that. So yes, we do end up into a situation where there are some loopholes, but we need to figure out a way how all these things has to be handled. So that is where all these different applications, the configurations, all this thing comes into picture. So I think Wockhardt has recently gone live on the online consultation.
Yeah, we have done online teleconsultation. We have started because since it was impacting the business, because Wockhardt, Mumbai is especially in the red zone, so where the maximum business comes. So the other hospitals also where in the red zone, if there are no footfall, then we have started consultation, teleconsultation, and now that we have started now, the management wants to leverage on this, saying how can be effectively used, but they don't understand there is an investment by exposing, there is a vulnerability. There's something called a firefighting and a long-term solution. Okay, now we have, as an IT, we have shown to the management, okay, this is possible. It was always possible. IT was always telling, but it was not adopted. Now it is possible. Now management has realized. So now they have to, as ma'am says, the data privacy and is very important, because now there are other people who will be trying to take advantage of the situation. So as a IT department, we have to educate people who are working from home to use their credentials more wisely, not to share it with anybody. Then suddenly, I've been speaking to my other co-CIOs. Telemedicine and teleconsultation, almost every second or third hospital is either they have adopted it or they are in the process of evaluating. So post-COVID, things are going to be drastically different. People will be more doing consultations online, especially the follow-up consultation. Because the main doctor's concern was, I have not seen the patient, I can't see the patient, I can't feel the patient. Now with this telemedicine, IoT and all, there are a lot of devices that can be connected where vitals can be captured and the doctor can see like your pulse, your BP, your temperature. So once this was the barrier in technology why telemedicine and teleconsultation was not used. So now I think post-COVID era, a lot of focus is on teleconsultation, telemedicine, and obviously security, data privacy, data security. So this is going to be a game changer, and the management wants to leverage on the IT to save on cost by seeing how much of increase in bandwidth can reduce so much of my workforce. They can work from home. Even a marketing can be done. Meetings can be done online. No need to come to the office for a meeting. So all these things are already being uh, brainstormed. So it is now for the IT to deliver and propose a solution to the management. This is where the healthcare IT is on the fence of being a service department to a game changer in the business.
Yeah. See, and in the Shalby, now the more focus is going on digital promotions. The entire marketing team planning has changed. Initially, they used to it was more of a promotion on the newspaper or more of promotion on the leaflets and all this stuff. Now everything is gone digital. Everything is on a like Facebook. My Facebook has come. Google Ads have used. My WhatsApp integrations has been done. So many things now. They actually the healthcare is understanding the need of an IT in this scenario and how business can be continued in this with the how IT can become an enabler for the business continuity rather than a expense or you can say cost center where like okay things are happening so it's fine, correct. I think you might have gone through that scenario where okay you suggest something and they'll say okay no it's fine as of now it is running like this so let it run like that, great. So now people are asking okay
From
can
the
we improve
service
this.
department to the enabler, that is the
Yes,
change
yes,
in the mindset what's happened. First, it
yes,
was just
yes.
a service department like any other. Now, from that, it is now it will play a major role in the business continuity in driving business digitally and electronically. That would be the statement from our side.
Yeah. Yeah, so if anybody has any further questions, they can, do we have an interactive session also? Praggya here?
People are sending us a question. Ma'am, there is one
Mhm.
question about auditing, cybersecurity audits. So
Hmm.
few people are asking that how to do that, how to go about it in hospitals and smaller hospitals. I can see there are more people on that side. They're talking about cybersecurity audit. Yeah.
See, basically, if you look at the auditing part of the thing, you need to make sure that your entire applications has been audited properly. You have a processes in place. Audit process needs to be defined to ensure that, and it depends on what level of auditing you want to do. See, it is a control audit is what the primarily people go for control audits.
Yeah.
Most of the time, and now with this change thing, people have started doing an infra audit also. So infra audit, what I mean by that is that okay, they'll ensure that okay, your application which you are using is not vulnerable. Your network which you are using, how easily anybody can penetrate into that. So those kind of stuff they've started auditing now, along with the
Yes.
control. So control was the main audit. Now they have started auditing infra also.
Absolutely.
Like in NABH, the other departments had a process. IT also, there is a IT policy. So in IT
Right.
policy now, this has to be mentioned to what level you want to, because previously there was no work from home concept. So like NABH has guidelines for clinical things, so NABH also has guidelines for an IT audit. So now this has to be revisited and reframed post COVID. Right, Jabin?
Yeah, that's true.
It has
Very
to be
true.
included in the IT policy now, which
IT
was not.
policies, yes. Yeah.
And there is another question on the frauds because of the customer care helpline numbers. With e-consulting growing and teleconsulting growing, there are people who face frauds with customer care numbers. So, is there any kind of attention that you are giving to this issue?
See, fraud, if you can define what is a fraud, see, basically fraud is a people who will register won't turn up. That is one of the frauds. But if you're talking about data leakage, or what are
Yeah.
you talking about?
Or any financial fraud related to those numbers that have been given, or any kind of data hack? Because with e-consulting or teleconsulting, I think we are seeing this. Hospital customer care numbers are replaced by various spoof numbers. So
Mhm.
in that case, misguided information or any information that is that can hurt any customer or normal consumer, which they are not aware of, that they can be a victim of any kind of breach while calling a hospital.
There
So
is
are
very
you taking
little that can, yeah, I got you. There is very little that can be done outside, but there is something called a firewall where you can set the policies regarding the data prevention and the data leakage from your database. Now, what you are talking about, having spoof email IDs and all, that is again a part of educating the people. There's nothing much can be done from the hospital, because uh, there are a lot of people who forward this mail. Array, this mail came from your managing director and says you release the payment, and also awareness and educating people on that side has to be done. But internally, your firewall configuration is a key, which has to be how you define your policies so that people can't get in your database through your VPN and access the data. So that is very critical. This happens especially where there is a Wi-Fi, there is a public Wi-Fi, like you must have visited hospitals where there is a free Wi-Fi access. So people try to get in through the Wi-Fi access and come into the domain. So how you define those VPNs and all that has to be taken care of. That is the key.
And there is one question from Mr. Brij Bajaj. With telemedicine now allowed, what are the security aspects to be mindful of considering the recent Zoom experience?
See, I think government has recently released telemedicine guidelines, and they have, I think, tweaked a bit, which is, I think, freely available over the net. So there are a lot of guidelines where you, as a telemedicine company, you have to adhere. You can't prescribe certain drugs, which are there are some guidelines which are already available. So whenever you are evaluating a solution, you have to ensure the guidelines which are being published are met. And there is one more body which is also doing a lot of work, Digital Health India. That is the name of the body, who's evaluating a lot of telemedicine company, and they are coming up with a registry. In fact, I was a part of the evaluation panel where they had a lot of other institutions, representatives, one from Kaho, one from him, from 3 to 4 institutions, and they evaluated all these telemedicine, and they are coming up with it. So whoever is interested in knowing which are the good companies which are offering telemedicines, they can refer to the guidelines and the registry, which will be coming out very soon.
So, Mr. Bhushan Reddy is asking about your opinion, panel's opinion on GDPR compliances. So, we are seeing, not many people are aware of the GDPR compliances and the guidelines that has been released. So, what is your opinion? So, are you looking forward to anything on that?
You can go ahead, Girish.
No, all these compliances are now there. They come up again. It is again your IT policy which has to be revisited, because now the whole healthcare security framework has changed. So whatever policies and all have to be first written down, understood, communicate, sat down with the management, then has to be published so that everybody, the internal user and external user, they're aware that there is whatever solutions we are using. Because all these, whatever solutions are being procured are all third party solutions. So at the time of evaluation only, we should ensure that the guidelines, maybe GDPR, data prevention, data security are being taken, because these are only configured at the hospital end, but these are all third-party solutions. Madam, if you can comment on this.
See, basically, whenever you are, it starts with evaluation process, basically. So you need to make sure that whatever the services you are buying or where your data is getting stored, whether it is it's a compliances are there, which includes my HIPAA compliance, my all other type of healthcare compliance should be there. Second thing is you need to see that, okay, if you are in India, then where is your patient data getting stored? Because everybody has a policy, every country has a policy, and we need to adhere to those policies. Third thing is, it's always advisable to have a network security team as a part of the IT, which will do this compliance check before you go ahead and give a go ahead for any of the applications. And make sure that you always get an audited done of the infra where you are storing all your patient data. So with this few things, I think you'll be able to make a clear policies on what to do and what not to do, and how it will.
Yeah. For example, when you're procuring a solution, the vendor will say that the data is stored on the cloud. So we need to ensure whether the cloud is uh, it is in India, outside India. Such small things have to be taken care. And also now,
And
because of all this, we all the hospitals didn't have a CISO, that is your Chief Information Security Officer. Now every hospital like has a CIO. CISO is now become a very important portfolio.
And see, if you
So there
see
was
the CISO, the structure should be your management, top management should be driving that. So CISO actually reports to the top management, your CIO and the top management. So that is very important. And if you talk about the GDPR policies, it is applicable not only to healthcare, but it's applicable to other industries also. So this talks about more of your data, the customer data. So that you need to make sure that it's compliant.
right.
Yeah.
In fact, there was a question by by an attendee that what should be the reporting structure of CISO, and like ma'am answered that it should be the top management they should report to.
Yeah.
Would you like to add a few
Yes,
more things?
CISO and CIO should be at the same level actually.
Level.
You can't
Yeah.
have a CISO reporting to a CIO or a CIO. Both are independent functions. If we are independent, it is better because the focus should be on security. A CISO should only focus on security. They have to work in conjunction, but they have to be at the same level. So to be fair enough, if a CISO is reporting it to CIO, it doesn't make sense.
So they
Yeah.
have to be integrated and together they should report to
Yes.
the higher management rather, because they are not in independent functions, basically IT and security. They have to be integrated. And we discussed security by design in the banking and financial sector, which when you talk about security, it should come as an inbuilt thing in any kind of solution that are adopting for any practices or for any services.
Yeah.
Right. So any other questions that have come up?
I think this is enough for the day, I believe.
Okay.
Yeah.
Okay.
Would you like to summarize the discussion and then we can close the panel?
I think that's it. If anybody has a question, we can address that.
Yeah.
So no more questions related. These are questions related to social media and very generic, not really specific to hospitals as such. So I think we can answer them later, maybe.
We can mail if there is any relevant question. We can just mail us and we can reply back to that.
I will do that. I will do that.
Sure.
Thank you so much, ma'am.
Okay.
Thank you so much, sir, for joining.
Thank
Bye.
you.
Good day.
Bye.